Hi everyone, welcome to today's People and Planet webinar, an ongoing series presented by the University of Minnesota's Institute on the Environment. I hope you're all safe and secure where you're joining us from in the world today, and it's great to have all of you with us here online today. I'm Todd Reubold with the Institute on the Environment and Ensia. For those of you who don't know, the Institute is leading the way towards a future where people and the planet prosper together. And Ensia, which is published by the Institute, is a solutions-focused media outlet reporting on environmental issues all around the world. You can learn more by visiting ensia.org. So why are we here? The People and Planet series brings together experts from within the University of Minnesota and beyond to ask big questions and dive into the most pressing sustainability issues of the day. And we want to hear from all of you too who are joining us. In Zoom, you can post your questions in the Q&A section, which should be located towards the bottom of your screen. And if you do ask a question, please include your name and your location. We'll be dropping in your questions throughout the discussion, and we'll have a good portion of today's discussion devoted to your questions. And I want to say a special thanks to those of you who've already submitted questions in advance. We'll try to get to as many of those as possible. Today we'll be discussing an often underreported issue, drinking water contamination in the US. We'll be looking at this issue from right here in Minnesota to the rest of the country. I want to start by saying thanks for the support from the Park Foundation and the Water Foundation. Thanks to their support, Ensia launched Troubled Waters, a 9-month investigative series exploring this issue earlier this fall. Our lead writer for the series is Seattle-based journalist Lynne Peeples, and Lynne can go ahead and join me if she wants to now. I'll be welcoming our other speakers to the discussion in just a moment, but I want to spend a few minutes chatting with Lynne about the series to help set the stage. So I want to get started with Lynne. Are you there? Yeah, hey, hi Lynne, how's it going?
Hey Todd, good to see you.
How are you doing from rainy Seattle, it looks like?
It's definitely rainy here, yes.
Well, thanks for taking the time to join us in this conversation this morning. I've loved your reporting so far in this series, and so I'm excited to talk to you in virtual person, I was gonna say.
Yes, yes.
Great. So I want to start out by just, we've been working on this series for about half a year now. What surprised you the most so far in the reporting that you've done? Or are there people that you've interviewed or, issues that you've come across that have really kind of stood out for you so far?
Yeah, sure. I'd say a lot of surprises so far. I've learned that, while we have some of the best water in the world here in the US, there are still plenty of concerns, and it's not just lead, which obviously is now on everyone's radar since Flint, Michigan. But many parts of the country are dealing with PFAS chemicals, which have started to make more headlines, volatile organic chemicals, disinfection byproducts, pesticides. The list kind of seems to go on and on the more I report on this. And since we began treating our water about a century ago, it seems like there's been a general shift from concerns about pathogens to more concerns about chemicals. But I've also learned that pathogens are still a concern in some places. One of my stories so far in the series focused on Legionella, which is a bacteria that grows in stagnant water and can cause severe pneumonia. So I'm learning that, some scientists are guessing more than 50,000 cases of that are still happening in the US every year. And I was surprised to find a COVID connection with that, this concern about this stagnant water in buildings that have gone without use for months, particularly in the spring and summer when it's warm, and that's kind of the perfect environment for these bacteria to grow. So yeah, it seems like these concerns are still out there. I've spoken with some folks that are personally affected by this, including a woman whose mom recently passed away from Legionella in a nursing home earlier this year. And then another surprising connection I found was with wildfires. I didn't realize another, big headline, national headline would come into play with this series, but it turns out that wildfires are finding a connection with contamination of drinking water with volatile organic chemicals, or VOCs. So also spoke with someone in California that's personally been affected by that, concerns about his safety of his water. So yeah, many surprises.
That wildfire story was really amazing. And folks, if you haven't checked it out, please do so. I should mention that the whole series is being published or co-published with a number of partners, including The Guardian, Consumer Reports, and others. And I saw that High Country News picked up that story and republished it too. So
Yep.
definitely check that out and all of Lynne's reporting and all the other reporting we've done so far. Lynne, you mentioned the contaminants that you're focused on. And, as we started to plan this series, it was amazing to me the number of contaminants that we had to choose from that we could focus on the reporting. It's pretty wide ranging. And when we were first thinking about the series, I was really thinking the focus would be on, those different contaminants. But as you and I discovered, really a lot of this story is the environmental justice angle to these issues.
Absolutely.
And so if you could just say a few words about, what you're seeing in terms of, environmental justice issues that have come up in the reporting that you've done.
Yeah, definitely seems to be a theme across the board. I think it seems that these contaminants are disproportionately affecting rural areas, poor communities, people of color. And in some regards, that's due to aging infrastructure, maybe more prominent in those areas, rural private wells being unregulated for contaminants. Also cost being a barrier for some of these small systems, which are often in rural areas. They just may not have the funds or the people to take advantage of the technology we do have available to make sure the water is clean. And then even on the household level, there is technology filters available, say, to rid the water mostly of PFAS chemicals. But a lot of poor families can't afford these filters. So I feel like, yeah, it keeps coming up over and over again that indeed this is an environmental justice issue. A lot of people facing the brunt of these contaminants in rural areas or from industrial discharges. Those also tend to disproportionately affect these poor communities. So that does keep coming up.
Yeah. So I mentioned we're a few months into the reporting now. Can you give us a sneak peek of what you're working on and what might be coming out over the next couple of months?
Yeah, sure. So the next stories, so PFAS, I have mentioned it a couple times. That is the next story in line in the series. So yeah, look forward to that coming out in the next week or two. And again, there you'll also see some COVID connections, which keep being surprised at that, but there's some concern about these chemicals suppressing the immune system, perhaps even getting in the way of vaccine effectiveness. Disinfection byproducts, another one coming out soon. Had no idea just that there was more than 700 of these out there, that we're discovering more all the time, and that there's some legit concerns about health with regard to those. And I just keep seeing this, the one theme I want to just add real quick is this idea of this toxic treadmill. I don't know if you're familiar with that term, those of you with us, but it's keeps coming up that we find these chemicals perhaps are hazardous to our health, then we come up with an alternative, replace it, and then, years later, decades later, we find out that those are just as bad, if not worse. And in these next two stories, that is playing a major role. I'm seeing that again.
Excellent. Really looking forward to those stories and hope you all check it out. Hope you check out the whole series too. We'll send out a link to the series if you haven't seen it yet at the conclusion of today's webinar. So we've got a lot to cover today. Now I'd love to bring in a couple experts from here in Minnesota to join our discussion. So through the wonders of technology, hi there, Mae. How are you doing? Great to see you. Hi, Tannie. How are you?
Thank you.
Hello.
Welcome to both of you. So just a quick introduction. So Mae Davenport is a professor here at the University of Minnesota in the Department of Forest Resources, and she's also the director of the Center for Changing Landscapes. And Tannie Eshenaur is Water Policy Manager in the Minnesota Department of Health's Environmental Health Division. So welcome to both of you.
Thanks.
Thank you.
By way of introduction and introducing yourselves, I was hoping you could just say a few words about how you first got started looking into these issues of drinking water and contamination and what you're working on nowadays. So Mae, if you want to kick us off, that'd be great.
Yeah, for sure. I'm a social scientist. I'm in the Department of Forest Resources, but I study people and their relationships with natural resources and the environment. And of course, here in Minnesota and elsewhere across the United States, people have a very intimate connection with water. It's a part of our survival, but it's also a part of our social and cultural interactions with one another. And so I'm really interested in how people value water, how people, what kinds of different relationships people have with water, not only for drinking, but in other experiences that folks have with water. water as an asset as well as water as a liability, because certainly when we think about environmental justice, there are positive relationships and at times negative relationships with water. So I'm very much interested in the social aspects and the human dimensions of water, including drinking water.
Excellent. And Tannie, how about yourself?
Well, I started in water following graduate school work in public health. I trained to work in the developing nations world. I went with my husband, who is a civil engineer, and we worked in Ethiopia and East Africa following the 84-85 famine, doing village level water supply. And then we returned to the States when my oldest child was starting college, and I never dreamed that I would find water work equally fulfilling here in the States. But I joined the Minnesota Department of Health about 20 years ago, working first on a unit, excuse me, that investigates releases of hazardous chemicals, and that was in soil, air, but also a lot in groundwater. And then about 10 years ago, there was an opportunity to work more on the prevention side of things and protection. And of course, being a public health practitioner, that's where my heart is. And so for the last decade, I've been able to work on doing planning and policy work to protect our groundwater and surface water sources for drinking water. And it's been very fulfilling in Minnesota.
Excellent. Well, welcome to both of you. So most times, I think, for most of us, we simply turn on the tap, we drink our water, and we don't think twice about it. So I want to throw out this question that actually a number of people asked in the questions we collected in the lead up to today's event. How concerned should we be with our drinking water? Should we all be running out and buying filters, or do we not really need to do that? Lynn alluded to the geographic scope of issues in this country, but they're not distributed equally. So I guess the question for the group is, how concerned should we be about these issues? And maybe Tannie, if you want to jump in first, that'd be great.
Sure. Well, I would say that it's really important to be aware of your drinking water and where it comes from. We often say that drinking water in Minnesota is invisible, largely invisible, but it is not invincible. We have a great track record in Minnesota of compliance with the Safe Drinking Water Act, but we know now, in referencing some of the things that Lynn was talking about, that it's not enough to provide the protection that we expect here in Minnesota. Probably the most important thing is to think about where your water comes from. Are you on a private well? In Minnesota, we regulate where and how you construct that well, but after that initial water quality test, you, the owner, are responsible for follow-up testing. And we know from research we've done that only about 30% ever do follow-up testing. If you're on a public water supply, then you can be confident. If there's something found in your water, you will be notified and you'll be given instructions about what to do to continue to have safe water.
This issue of private wells is something we're definitely going to dig into as we go along today. But Mae or Lynn, do you want to jump into this question too about how concerned should we be about our drinking water in this country?
I'll just underscore what Tannie said about public water systems do a great job on the whole of notifying their customers. So I know in speaking with a resident in California who was facing that contamination from the wildfires, there was a notice that went out to the whole community about, do not drink, do not boil this water. There is some nuance there as to how far, if they went far enough, that there's even concern about using the water in dishwashers and showers because volatile organic compounds can be inhaled. But on the whole, I think, across the country, we're doing a pretty good job, at least in larger systems, of paying close attention, and also of using the technology available to filter and disinfect the water. Carbon activated filters, reverse osmosis. There's some technologies that are really showing a lot of promise and doing well at cleaning our water.
Yeah. How about you, Mae? What do you think about this question? Yeah. Well,
I of course agree with both Lynn and Tannie, and I think part of the challenge here in Minnesota is as Tannie says, a lot of the drinking water is invisible. It comes from groundwater. 75% of Minnesotans get their drinking water from underground in aquifers, and we know that not all folks are really ready or able to have their water tested or treat their water because of just a lack of awareness. But there's a lot of constraints in some cases that can get in the way of water testing. And we're just starting to understand sort of what motivates people and what are some constraints that people experience when they're thinking about their drinking water, and when they're thinking about having it tested. So that's been really important, is to understanding sort of that psychological process of thinking about water, something you use every day, and whether or not you should have it tested. How safe your water is important.
I have another question I want to ask all of you, but a quick follow-up, Mae, to what you just said. What tends to push people over to that point where they say, okay, I've got to get my water tested? Is it something they're tasting, smelling in the water? What's the motivation typically to do that?
Yeah, Todd, that's a great question. And as I said, we're just starting, my center is just starting to do some survey research with private well owners in central Minnesota and northwest Minnesota, where we hope to answer that question.
Okay.
But we do know, anecdotally, we know that there can be some concerns tied to increased regulations on land uses. And I think you know, in Minnesota, everyone wants to believe, and across the nation, that your water is safe, and it can feel risky in some ways for some people to test the water, which it might be hard to believe. There are a lot of barriers, though, that I think get very complicated in kind of thinking about whether or not your water is clean. And we know that there are folks who have public water supply and water is very clean, who won't drink it here, and especially in urban areas. And so there's a lot of, I think, misunderstanding or misconception, but I think part of the blame can be put on how we're communicating around water, and sharing sort of what we know about drinking water with residents across the state and across the country.
So Lynn mentioned, go ahead, Tannie, sorry.
I was just going to jump in and say that we did a study of people who had recently built new wells, and we asked them about their testing and when they would do a test. And people who test their wells in that study did it because their neighbor recommended it, or because their well contractor or their physician. And MDH was at the bottom of the list of people that they considered to be trustworthy in some ways, that a local advisor is more trustworthy than someone far away.
Very interesting. We're going to get into this question in a little while, of where people should go and what they should do if they think there's something wrong with their water, but I'll hold on to that for just a moment. So Lynn, in the opening, mentioned the pretty wide range of different contaminants that we're looking at in this series. I wanted to ask each of you, though, it's a pretty wide-ranging list of different contaminants we could be considering, could be looking at. What keeps each of you up at night? When you think about the list of different contaminants, and obviously not all contaminants are equal in terms of their geographic spread or the impact they might have on humans and wildlife and nature. So what contaminant, though, of all those that might be out there is the most concerning to each of you? And so maybe we'll start with you, Mae, on this one.
Well, I've been really focusing on central Minnesota and thinking about the groundwater contamination. And so I know that nitrate, for example, is and nitrogen is a nutrient that's used in agriculture. But if it gets into groundwater, which it can do, it can cause problems and health concerns among especially vulnerable populations, young children. And so that's something that I'm concerned about, especially vulnerable populations who may not have the resources or the time to think about, their water and to have the testing done. And so that really is concerning for me.
How about you, Lynn? What jumps to mind for you from the reporting you've been doing?
Yeah, it might be because it's fresh in my mind with my reporting, but disinfection byproducts are really kind of coming up on my radar now. I'm personally probably going to be doing some investigation into Seattle and how we're treating our water, but just learning the connection between these kind of previously unknown interactions between the disinfectant and any organic material or even man-made materials that we're putting in the water. So between runoff from farms or sewage interacting with chlorine or some new disinfectants that we're using to replace chlorine like chloramine, those interact and create these kind of novel chemicals that we're understanding can be potential carcinogens and such. So that's, it seems like it's pretty widespread around the country from the scientists I'm talking to. Just about everybody's water, if you're on a public system, will have some disinfectant byproduct in there.
So when you say disinfection byproducts, are those byproducts that are used to treat water? Is that what that is? Just so
yeah. So disinfectant byproducts are a big class of chemicals that are formed with the interaction between what's the disinfectants that are put in the water at the treatment station and other things that might be in that water already, like bits of organic material and like leaves fall in, lakes, rivers, they can break down, that can be in the water. And that interaction creates these other compounds that we're finding can be potentially hazardous.
Right. Tannie, how about you? What's on your radar right now?
Well, I'll bring up a contaminant that's a bit less sensational, less glamorous than those, but arsenic is a challenging contaminant in Minnesota. It's challenging because it's natural. It comes from the geology. We have a lot of it in Minnesota. About 10% of our new wells exceed the drinking water standard. And it's a big issue for people who are on private wells. It's a big issue even for smaller community systems who don't have the customer base to pay for arsenic treatment. And another reason we have for concern is the drinking water standard that the US EPA puts out is 10 micrograms per liter. And we know that that number is balanced for cost and treatment, all those kind of aspects. It's not a purely health-based number. The health number, if we were just considering health outcomes, would be considerably lower. And we know it's a known carcinogen across the lifespan. So it's a challenging contaminant. It doesn't get a lot of coverage. But it is a genuine threat to human health here in Minnesota.
And Mae, if I understand correctly, you've been doing a lot of work on private wells in your research. What are the issues that you're seeing with private wells? And we talked a little bit about the challenges with getting testing done, but what are some of the other issues that you're kind of uncovering through your work and your research?
Yeah, well, we know that there are landowners who cannot drink their water because of contamination from their private wells. And so they carry in water, have to purchase water and carry it in. To buy a private treatment system for your water to remove nitrates and arsenic and other things, it can be costly. And so, and a lot of the research that we're doing, we're trying to understand sort of the impact of free water clinic opportunities that counties and other organizations like the Minnesota Well Owners Organization are offering these free testing opportunities. And of course, it's challenged a bit by COVID and the distancing that needs to happen. But we want to understand what brings people to these free water testing clinics, but also why people might not come. We have learned just anecdotally that a lot of grandparents are bringing their grandchildren's drinking water into these tests because perhaps they have more time and are certainly concerned about the children. And so we get some interesting sort of community relationships that come to play, as Tannie suggested, that people listen to family, they trust their community, maybe even more than state officials or even county level officials who might say you should have your water tested regularly.
So today's webinar is being hosted here at the University of Minnesota, a major research institution. And so I think this question that just came in from Taryn is a really good one to ask to all of you. Taryn is wondering, could speakers discuss the ways that science is incorporated into the regulations governing public water supplies, and who is the players and what is the process? So what are the ways that science is brought into this whole policymaking process? Tannie, you're shaking your head, so maybe I'll jump over to you first.
Well, in Minnesota, we get the enforceable values from the U.S. Environmental Protection Agency. And there's a long extended process that they go through, starting with scientists. Then they go through a process of doing something called the unregulated contaminants monitoring rule, where they look at about 30 contaminants every 5 years that are not regulated to see, are they out there? Are they being addressed? Are they a threat to human health? And there's also a candidate list of contaminants that, that's built on the science, but it's a really long extended process, and it takes years to decades for EPA to adopt a new enforceable standard. At the Minnesota Department of Health, we're really fortunate to have a group of health risk assessors, toxicologists who are able to look at the research and the literature. They're given the authority to do that by our groundwater protection rule, and they come up with health-based guidance. They're called health risk limits. They are not enforceable in the state of Minnesota, but they are a way of providing guidance for cleanup for our colleagues who do the Superfund work at the Pollution Control Agency. And then we in the drinking water program also use those values to make strong advisory recommendations for unregulated contaminants that they meet these values. And of course, public water suppliers, they want to have a trustworthy product. And we have really good relationships with them built over decades of work. And so they do everything they can, if the resources are available, to meet those guidance values. So the science is regularly incorporated into that. I know I took a look at the arsenic federal primary drinking water standard in the federal record, where they provide all the science both for the toxicity as well as cost benefit. It was 75 pages. So pretty daunting work that they're doing at that level.
We just had a question come in from an audience member that I want to throw into the mix here. I think it's actually a really, really good question. This person, Karen, I think it is. Yeah, Karen is wondering, she wants me to ask all of you, do you drink the water that comes out of the tap in your homes? And I will be the first to disclose that I do, and my wife is a huge proponent of the zero water filters, and I keep asking, why do we have to use this filter? So we're a bit of a mixed family at our house in St. Paul, Minnesota. But how about the rest of you? Do you drink the tap water that's coming through the pipes to your homes? Lynn, do you want to go first?
Sure, I do. And I think I may finally invest in a Brita or Zero, or one of those though, just based on my recent research. But generally, I think water in Seattle is pretty clean, so I feel relatively safe drinking it.
Great. How about you, Mae?
Yeah, my water, like yours, Todd, comes from the Mississippi River, and we drink it right out of the tap. Of course, it goes through a lot of treatment before it comes to our house. But yeah, my family and I drink the water out of our tap. I will tell you, though, we have had some don't drink the water alerts, and those can be particularly alarming, especially when I had young children and I, was feeding those children formula that had a lot of water in it, and when I got that alert, it really scared me, and it made me start to think twice about the water, and want to know exactly where it's coming from and how it's treated.
Tannie, how about you? How about yourself?
Okay, well, I live in the city of New Brighton, which is downstream from a huge groundwater contamination plume that is known as TCAP, the Twin Cities Army Arsenal plant, from munitions that were manufactured in the 1940s and so on. And so New Brighton has had treatment put onto their system originally because around the 1980s, trichloroethylene was discovered. So the Army had to pay for these huge 2-story tall GAC, granular activated charcoal, or filters to take out the TCE, and then more recently, 1,4-dioxane was discovered in our water as a part of this unregulated contaminants monitoring rule. So
Wow.
again, New Brighton went back to the Army. They paid for an advanced oxidation plant. So I'm very, very confident of our water because those two treatment processes, they're just cutting edge, particularly the advanced oxidation. And I know that treatments that people have in their homes, they often don't maintain them. And so that can be a source of bacteria. We have evidence from one of our EPI studies that people who had water softeners or water treatment devices were more likely to end up with gastrointestinal illness.
Wow. I want to ask kind of a big question, then drill down to Minnesota here. So I kind of like nationwide, and then we'll drill down into Minnesota a little bit here. So I'll start with you, Lynn, with this question. You talked a little bit about California and obviously the issues we've been seeing for years or decades now, I think, in the Central Valley there and elsewhere. But something we've discovered in this reporting is that, and I think personally I'm a little bit biased, but a value that Ensia's reporting on this issue is bringing to it is we're stitching together these stories from around the country and showing that there is something larger that's going on here. So my question for you, Lynn, is where are some of those hot spots that you're seeing around the country in terms of drinking water issues? And then I'll follow up with Mae and Tannie, and we can dig down to Minnesota a little bit more in terms of where are some of the hot spots here in the state too. So Lynn, if you want to kick us off, that'd be great.
Sure. So as far as hotspots go, so yeah, California Central Valley, in terms of a lot of agricultural pollution, nitrates, and that's a similar concern in much of the Midwest, agricultural areas of this country. That's a big concern. North Carolina and some other spots on the East Coast are facing a lot of the PFAS concerns, because that's where a lot of the industry has been using or making these chemicals and discharging them into rivers and such that we've only recently realized are contaminating people's water. So those are big hot spots. I think there's just spatterings all across the country of places in which like firefighting foam is used. That's also a source of PFAS contamination. So military bases are another big one. And I'm trying to think what else would be coming up. But yeah, I mean, as far as disinfection byproducts, that's across the country. There really isn't any part of this country that's not touched by that concern.
Okay. And Mae and Tannie, what are the issues, or where were those hotspots here in Minnesota? Maybe Tannie, I'll kick this to you first, because you and I were actually talking about this a few months back in terms of some of those locations to watch out for, or be aware of here in the state.
Yeah, so we have a history with per and polyfluorinated alkyl substances that goes back to the early 2000s when 3M told us that they had disposed of manufacturing waste at 3 places in the East Metro. So that area has largely been addressed, and there is now plans for long-term ways to address the PFAS contamination. That's both for the public water supplies, the communities out there, as well as people who are on private wells. So that has been very thorough. The Pollution Control Agency is going to be doing a statewide inventory. We looked for the firefighting foams towards the end of the 2000s, around 2007, 8, around then. We're going to do another look for those, and based on what the Pollution Control Agency finds, we'll do follow-up with water supplies. Nitrate, we have issues where, you know, there's a broad swath across the state where it's primarily agricultural. So the Central Sands area that Mae mentioned, southeast, because of the geology there, it's karst, so it just runs through the geology down there. And then in the Southwest, we also have issues with nitrate because of the geology there, and they don't have very many aquifers to choose from. They also don't have a lot of water in that area. I mentioned arsenic. It follows the Des Moines lobe in the geology, kind of a big C through the state of Minnesota. Then we're also looking into things that are legacy contaminants that have to do with point sources. So TCE and 1,4-dioxane, we want to make sure that we're keeping ahead of those. And the disinfection byproducts that Lynn mentioned, through UCMR, we did some looking for one of them in particular, NDMA. I won't say the long name of it. And we did find it in one system. And so what we want to do is be able to go look upstream, because it does come from organic matter that's in the source water, and it has to be surface water systems. So we want to be able to find where are the precursors that cause NDMA to be formed, and can we address it there? Because disinfection is a very important part of water treatment and making sure the water stays safe as it moves through the distribution system to people's homes.
Mae, that was a pretty good list. Do you have anything you want to add?
Well, no, I was going to talk about the Central Sands or Pineland Sands region, and also the southeastern portion of Minnesota, where there's a lot of karst. And as Tannie said, because of the geology of the karst region, any water that falls runs very quickly into the groundwater aquifers. And I think we haven't mentioned climate change yet, but climate change and you know, the relationship between surface water and groundwater in Minnesota and other places across the nation is very close relationship. And any major storm events or spring melts where we have a lot of water that is running off, you know, through those karst systems, it picks up pollutants and goes right into the aquifer. So that's a big concern. And I think it's a concern also in urbanized areas where we have a lot of impervious surfaces, you know, roads and parking lots and buildings, is that water runoff, and how it affects the groundwater quality is a big concern.
A number of, we're getting some really tremendous questions from the audience, by the way, so I'm trying to get to as many of them as we can here. A number of people are asking questions related to policy and policy formation related to drinking water issues. I'm going to pull out this question from Sam in Los Angeles that came in earlier, and can kind of build off this, and this could be a statewide or national approach to answering this question. But Sam was wondering what kind of actionable policy recommendations are available for the general public to support. What specific agencies are in charge of implementing these recommendations? So if someone wants to get involved in influencing or informing policy, how would you advise them to dive into that side of this, this issue? And I'm not sure who to direct that to, so if someone wants to volunteer to go first.
I can talk about it in Minnesota.
Great, that'd be wonderful.
You know, federally, there are two major acts, the Clean Water Act and the Safe Drinking Water Act, that provide the foundation for managing our water resources. So in Minnesota, the agency for the Clean Water Act is the Minnesota Pollution Control Agency, and for safe drinking water, it's the Minnesota Department of Health. And so interacting with them, there's often open comment periods when there's permits up for review. There's lots of opportunity for stakeholder involvement. In Minnesota, we have something called the Clean Water Council. It was established in 2006. It's 19 people who represent different special interests in the state: ag, farmers, hunters, fisher, watershed districts, cities, counties. And they are very, very open to stakeholder involvement. They develop policy recommendations. So I gave a link to you folks to put up afterwards to their latest report. In there, they have policy recommendations that they're making to the governor and to the legislature on managing chloride in our waters, reducing the use of water softeners. They have a recommendation that well owners be required to test their private wells at the point of sale as part of a real estate transaction. And those were created based on stakeholder input, and they get legs at the legislature. There was one on providing living cover in wellhead protection areas, and that really helped us advance our protection work in vulnerable wellhead areas. So there's lots of opportunity. And there's more opportunity even at the local level, working with cities, local public health, watershed districts, soil and water conservation districts. If you're interested, there's a place for you.
Okay, great. That's good to know. Lynn, someone has a clarifying question for you back to the disinfectants for just a moment.
Sure.
Julie is wondering, do you mean the chlorine that's used to test water or disinfectants used by households that go down the drain? Or is it something else completely?
Oh,
When we
sure.
talk,
Yeah, thanks
yeah,
for that question,
yeah,
Julie. I'm speaking to the chlorine and other disinfectants that are added at the drinking water treatment facility. So those are added, and it's critical, as I know others have mentioned, that we do treat the water to get rid of those pathogens and things that used to make us real sick. But the chlorine, and now there's chloramine and some other disinfectants that are typically added, and those can interact with other things in the water to create these byproducts.
great. That helps a lot. Thank you. Daryl has a really great question too here I want to ask the group. Daryl is wondering, what are the challenges in identifying holding responsible those who, sorry, let me start again. What are the challenges in identifying and holding responsible those responsible for contaminating community and private drinking water supplies? So what can someone do if they think they can point to or know they can point to the source of that contamination? Mae, is that an issue you're running into at all in the work you've been doing?
Well, I can say that a lot of these, like for example, nitrate and other pollutants are called non-point source pollutants because they come from very dispersed places, and it doesn't come out of the end of a pipe. You can't point to one landowner or one industry, and so it's a big challenge. In Minnesota, we asked for voluntary participation in most of those practices that can help keep water clean from and protect against the pollution that comes from those non-point sources. So it's a big challenge. But I know locally, if you are concerned about a potential polluter in your community or in your county, you can reach out to county officials or others to inquire about that particular land use or property owner. Tannie, maybe you have some insight as well.
I think you covered it for the non-point sources. It's largely volunteer and it's hard to track. On the point side, we have the Superfund program, which provides relief in those situations. It provides a way to clean up and it provides the resources to do it. So I think we have a good system in place for doing that. And probably the best example of that is the PFAS contamination in the East Metro. And that kind of looking for sites and investigating sites continues to go on across the state and checking on previous sites to make sure they're still protective of community health.
Lynn, have you come across any stories in your reporting of individuals or communities that have been able to push back against that source of the pollution at all?
To some extent, I know with regard to PFAS, again, on the East Coast in North Carolina, there's been ongoing work through the courts to try to hold the companies responsible that have been discharging the pollutants. So that's been some work, but yeah, between industry and the government and community stakeholders. Some progress, but it's been slow from what I understand.
Sure.
Yeah.
So we mentioned environmental justice in the intro, so I want to come back to that because a number of people are asking about this issue too. A question here from Jennifer does, I think, a nice job of summing up some of the questions here. Where do you see room to improve policies and practices in improving environmental justice for marginalized populations when it comes to drinking water contamination? So what are those policies, practices that we should be looking at connected to environmental justice to really improve our drinking water? So does someone want to volunteer to jump in on that first? That'd be great.
Just one thing that immediately pops to mind that came up in my reporting for the first story, that there is some effort to push forward with some consolidating of some of these small systems, which often face some of these more significant pollution, more significant contamination, and often are these more marginalized communities. There are some efforts to try to pair them up with larger systems so they can kind of take advantage of the technology and the manpower to better treat the water. So that's one strategy. I know in Kentucky, I believe, like between the I think 1970s and like 2018 or so, they dropped from about 3,000 systems in the state to fewer than 800. So again, that's kind of, yeah, sharing the wealth and helping to clean the water of those smaller communities.
Great. Mae, how about you? What are your
Yeah,
thoughts?
and I mean, I would just add that I think a lot of times when we think about environmental justice or water justice, we think about the sort of supply of clean and healthy water, and you know that access to clean drinking water is a human right. It's a primal need for survival. I'm really interested also though in the decision making that comes with, you know, and the responsibilities that come with water as an important resource. And I think we really need different voices in the decision making. We need to better diversify and better represent Black, Indigenous, and people of color in these agencies and in the public water supply industry, because we need those voices, because they're so important in terms of understanding different relationships to water, but also perceptions of water and beliefs of water, and to better be able to communicate the science, which, to be honest, science isn't necessarily very motivating for a lot of people. They're motivated by their emotional selves. They are motivated to act because they're compelled based on their values, based on their relationships with their family and communities. And so how we better communicate to people around their water and drinking water is really important. And the best way to put together communication and outreach programs is to have those people engaged in the design and the policy making and the program development. So I think we need diverse voices. We need to diversify our policymakers and decision makers and managers to better reach a broader public and to better ensure water justice.
Tannie, what are your thoughts on this issue?
I really agree with Lynn's assessment of smaller systems. In greater Minnesota, we face that challenge. And you look at, we have about 1,000 community systems in the state. More than half of them serve populations less than 500 people. So that's a lot. They don't have the resources. They don't have the technical capacity. Those people are paying a higher percentage of their monthly income for their water. It's more expensive there. There's the issue of downstream contamination. I have to pay to remove contamination, but I didn't profit for the way the chemical was used in the first place. And then to build on what Mae said, we have a lot of newcomers in the state of Minnesota, and because of where they came from, they're used to buying bottled water and they don't trust tap water. And so we have been working to try and understand that better so that they don't have that household expense. And so, for example, the city of Minneapolis will take some of those immigrant group, their community leaders, and give them a tour of their waterworks there on the east bank of the Mississippi so that they can see the effort that goes into it. Because we also know that bottled water, besides being an expense, is not as thoroughly tested as water that comes from a tap.
Great. A number of people are asking this question. I was just scrolling to see if we had the answer here, but we don't. Other people are asking this question about what to do if they think their water is contaminated, if they know their water is contaminated. And I was just thinking back to when the team here at Ensia at the University of Minnesota was planning this series. One of the questions I asked our editor-in-chief, Mary Hoff, was, could we put together some sort of resource for people if they're in Michigan or Florida or Minnesota that would easily tell them, here's where you go? And what we quickly realized was every state is so different in terms of the reporting process and all the different agencies you need to deal with. So I'm going to maybe keep this question focused on Minnesota, but hopefully there's some lessons for other states around the country. Tannie, you probably know this best. If someone thinks or perhaps Mae knows this question too, but if you think your water is contaminated, where do you start? How do you start the process of getting more information?
So the first thing to know is, are you on a private well or are you on a community water supply? And you might think, well, everyone would know that, but in a study that we did on nitrate, people in the suburbs didn't know. So do you get a water bill? That's your first clue. If you're on a community water supply, they are required to put out what's called a consumer confidence report every July. They're usually found on a city's website. If not, they are all on the Minnesota Departments of Health's website, and I also provided a link to that place. So you can go there and see what was looked for in the water, what level was found, and what they're doing to address it there. If you're on a private well, then you can either talk to your local environmental health department, part of the public health system. You can talk to a soil and water conservation district, or at the department, we have regional hydrologists. Their contact information is on our website, and that's a good place to start. You could also talk to your well driller if you know who that was, and that will give you information. It's really important to know what's in your water and not just slap on treatment, because treatment systems are very specific for certain contaminants, and so you need to have the right treatment for the right contaminant, if you even have it. Much of Minnesota, you don't need any kind of treatment.
Yeah, I just found one of the, excuse me, one of the stories in our series on this topic, and there's a little sidebar for folks who might be interested. It's, it says, what's in your water, mentions the Consumer Confidence Report, also mentions resources for private water testing, and says too that Consumer Reports provides links to quality reports of various brands of bottled water, if that's something you're looking for too. So that resource is available in most of the stories here. We have a few minutes left here. I want to get to a couple more audience questions. A couple people have been asking about lead contamination, if that's an issue here in Minnesota. And a question I want to connect with that one since it's somewhat related. So first part of that is lead contamination in pipes an issue here in Minnesota, either in the Twin Cities or greater Minnesota? And then someone else is asking about public water supply question. Are there regular checks or tests done on the pipes within public and private buildings, like university buildings or condos or that type of thing? So Tannie, this might be a question back to you one more time. You probably know the answer to this question.
So yeah, we do have lead service lines in Minnesota. It's really related to housing stock and when those homes were built. We did a report looking at lead in drinking water in collaboration with the University of Minnesota, some of your colleagues at the Water Resource Center and at the Humphrey School of Public Affairs. And they looked at what it would cost to remove all the lead service lines in the state. We just have an estimate. We don't have a good, precise inventory. And what it would cost to remove the lead that's found in fixtures in people's homes and lead solder. And it's not really practical to go after premise plumbing, we call it, but lead service lines is doable. And the cost benefit analysis was that we would get $2 of benefit for every dollar we invested in lead service line removal. So we have been working with the Public Facilities Authority to find ways to fund grants to cities to help them accelerate the removal of lead service lines. The federal government is also supposed to be coming out with a revision to the lead and copper rule, which guides our enforcement activities. And we're waiting to see what changes happen in that. And we hope that there's a more aggressive stance on removing lead service lines in particular. The way that we test water usually is at the entry point from the treatment plant or from the well into the pipes that take it to people's homes. But lead is different. Lead and copper and disinfection byproducts, we want to know what people are actually being exposed to. So there are strict protocols for how we test for lead in the worst case homes when we expect to find lead because of the age of the home, and a certain percentage of customers within each community public water supply. And they have to do that on a regular basis. So no, we don't test every home. And we don't even say that that result is representative of the whole system, but in fact, it really represents, is the water system doing what they need to do to prevent leaching of lead and copper into the water. So it's a check on the health of the system, not of the water across the community. And it really reflects whether or not they're doing good corrosion control.
Great. We're just about out of time here today, and I want to thank everyone who's been submitting questions. I'm sorry we didn't get to all of them. There are some really great questions about working with indigenous communities, about how COVID is impacting our drinking water, some questions about media and how media covers this issue. Stay tuned, we're going to have future conversations. I'm sure this is a really critical issue. I want to give each of our speakers a minute, or maybe just a little bit less than a minute, to share any parting thoughts on this issue, or any final comments or just words of wisdom you have for our online participants today. So Mae, do you want to kick us off?
Sure. We conducted a survey in 2018. We surveyed residents across the state in Minnesota, and the number one value of water that Minnesotans think should be protected, the number one use of water is drinking water. And that's just fundamental to the value systems of folks in Minnesota, to know and have confidence that their drinking water is safe. And so it's just a critical discussion and dialogue that needs to continue. And my hope is that people, that residents, private well owners, and others feel more confident and more able to ask those important questions, to learn more about where their water comes from. Because I think that dialogue is going to be what ensures that water remains at the top of our list of protection strategies for the environment. And so I think that's critical, is that we continue this dialogue.
Excellent. I'll go in the order on my screen here. So Tannie, and then we'll come to Lynne to wrap us up here.
Okay, well, part of my job at the Minnesota Department of Health is to look 25 years into the future and say, what do we need to do now to make sure there's safe drinking water for everyone, everywhere in Minnesota? And when I look at the situation today, I have to look back and think of the people that came before us that made significant investments in protection, in treatment, and in monitoring. That's why we have the quality of water we have today. So I'll just remind everyone that drinking water is invisible, but it's not invincible. And now is a time when we need to invest, particularly in protecting our source waters, so that we have safe drinking water into the future.
Great. And Lynne, your parting thoughts for today?
Sure. So I guess I would just say, this is not something that should freak everyone out, but definitely, as has been said, it's really best to keep yourself informed. Yeah, know where your water is coming from. If you're on a private well, have it tested regularly. And if you have concerns, or if you're concerned about, other maybe environmental justice communities, speak out, talk to your representatives, submit comments when regulations are under consideration, and just, I guess be aware. And then there's little steps you can take yourself, as far as not flushing things down the toilet or down the shower that could potentially get to the drinking water system, and things you put on your lawn that may, run off into the waterways too. So little parts that we can all do to help keep everyone's water clean.
Thank you. And I want to thank all of our speakers again today for participating. I'll give you a virtual clapping here from everyone. I also want to thank all of you for participating today. It's been great to have your questions, great to have you all involved today. Big thanks to the Institute on the Environment for hosting today's conversation. Thank you to the Park Foundation and the Water Foundation for supporting this reporting and this coverage of these really critical issues. You all should be receiving an email with a video to today's talk, and also some resources that we put together there for you too. And so with that, I want to thank everyone for participating, and we'll sign off. So thank you and goodbye, everyone. Take care, everybody.
Thanks.